theme of this practice is self-care. So always useful, but particularly useful if we are low on energy or feel a bit under the weather in some way. So when we do a self-care practice, it's always good to start with noticing how we are. So you might have come into a meditative or restful pose, sitting or lying, and then checking, how does this feel? And at that point you might realize, I'm feeling a bit chilly, or I'm lying in a draft, or I'd like a cushion under my right knee, or whatever it is. So taking the time to take care of something like that if you notice something like that. And being aware of how your body is resting on the ground, and that might just be through your legs and your sitting bones and your hips if you're sitting up. Or it might be through the back of your body and your head on the ground. And then yielding to the support. Really settling into the support of the earth or the chair, yoga block. And then bringing your hands first to your lower ribs. And if you're lying down, you can rest your elbows on the ground. So your hands might be quite wide or close together. Again, check in with your body. What do your shoulders feel like? If you're sitting up, you might have your hands more to the front, like I'm doing right now, and your elbows relaxed by your side, so that you can have a sense of your lower rib cage. You can also move your hands around a bit a couple of times to feel the shape of the curve of your ribs there. And then with our breathing practices, we're often actually emphasizing the out breath, and particularly a complete out breath, to make room for the in-breath to flow in very easily. So when we breathe out fully, it's kind of like creating a vacuum in the lungs. And the difference in air pressure between inside the lungs and outside will then automatically, with ease, bring in the in-breath. So with your hands resting in a comfortable way on or near your lower ribs, a few times you can breathe out fully, expelling all the air from your lungs, and then at the end of the exhale, relax. And notice how easily the in-breath flows in. And you can breathe in and out through your nose if that feels easy. It's hay fever season as well now, so if you're a bit blocked, you can always breathe in and out through your nose and mouth. Notice how your breath, how your lungs, how your ribs are feeling as you do this. Lovely. And then you can let your breath find its own rhythm. So with stronger breathing, it can feel quite nice to kind of clear out the lungs a bit and activate them a bit more fully. But we don't want to do those stronger breaths too long, because then we might get into actually hyperventilating and changing the balance between oxygen and carbon dioxide too much in our bloodstream, and we can feel a bit dizzy, for example. So usually just do between 3 and 6 of those stronger breaths, just to kind of wake everything up a bit more. And then we can place our hands, our fingertips on or near our collarbone, so the upper chest. Again, if you're sitting, you might do something like me, with your elbows just relaxed by your side and your fingertips on the collarbones. If you're lying down, it might be nice to have your elbows fairly wide in this kind of position, and let your elbows rest. And then first we can gently move our fingertips around a bit, around the collarbone area. That dip between the big shoulder muscles at the top, the trapezius muscles, and the collarbones. There's a little dip there, and towards the tip of the collarbones, near the upper arm, there's quite a few muscle connections. These muscles are involved with our breathing. They kind of lift the shoulders when we breathe in and relax when we breathe out. So we can bring our hands to that. You could even go under your jumper if you can. I've just opened my body warmer a bit so I can feel the muscles more clearly just under the skin. And then finding a spot to rest our hands, and again taking a few full exhalations, noticing what happens underneath your hands, and then breathing in, breathing out fully again, noticing how your breath is and what moves. And then again, letting your breath just find its own rhythm again. And then letting your arms relax by your side for a moment, with your palms up or down, resting on the floor. Or if you're sitting, just resting by your side, maybe just about on the floor, or if you're sitting cross-legged on your knees, can work quite well. And a little gentle shoulder exercise, shoulders and arms, and on the out breath, turning your palms down, turning your arms, your hands, your palms towards the floor, and on the in breath, turning your palms up. And following your breathing, seeing if you can follow the rhythm of your natural breath, your natural breathing pace as it is right now. And sometimes, when we're paying a bit more attention to the breath than we normally would, it can feel a little unnatural or contrived. So if it feels like that, and it feels that way, that you've just kind of forgotten how to breathe normally, and it's actually increasing a sort of sense of, I don't know how to breathe, am I doing it right, it doesn't feel right, something like that, then you can simply focus on the sensations in your arms, hands and shoulders, your sense of touch, knowing that your breath will take care of itself. And it can be useful in our yoga practice to develop more breath awareness. And sometimes it's useful to let it go. Just let our bodies breathe. They know how to do it. And then we'll do an arm movement with the breath again, or as I was just saying, you can focus more on the movement sensations if that feels more helpful. So this one we start with our arms by our side, lying or sitting. And then we take our arms up on the in-breath and down on the out-breath. Again, following the natural breath. Breathing out on the downward, breathing in on the upward. So again, it's bringing a bit more movement into the chest, into the ribs, into the shoulders, which are all involved with our breathing muscles, organization of our breath. So the less kind of tightness or stiffness we have around the upper body, particularly shoulders and rib cage muscles, upper back muscles, tummy muscles, the more easily we'll breathe. Breathing in and out, following your pace of your breathing. And then after your next out breath, taking a little pause again, and this time with your hands on your lower belly, just below the navel. And see if you can feel some movement there as you breathe. So when we're babies, young children, we tend to have a very natural, what we might call belly breath. Obviously we're breathing with the lungs, but belly breathing, when people say belly breathing, we generally mean that the belly moves when we breathe, because the lungs expand. When we breathe in, they expand forwards and sideways and backwards and downwards. So the diaphragm moves down when we inhale and pushes on the contents of our abdomen. So when we breathe in that way, then the belly moves forwards. And when we breathe out, the belly draws back a bit. Now, sometimes that pattern isn't there because at some point in our lives, we might have started to breathe a bit differently and kind of tensed up a bit in our diaphragm. It could be all sorts of reasons. It could be any digestive issues you've had, as some people might say. Digestive issues might occur when our breath doesn't do this anymore. It can be after pregnancy, because having a baby in the womb would obviously take up a lot of space in the abdomen, and then the diaphragm can't move down so well towards the latter stages of pregnancy. And then after pregnancy, the body doesn't always revert. And it could be all sorts of other things as well, to do with emotional stuff, shock, trauma, where we just get a little bit tight here in the diaphragm. So noticing how how your belly moves as you breathe in. Does it expand on your in-breath and drop back on your out-breath? Or if you can't feel that so well, don't worry about the why that is. There's practices you can do to find that natural breathing again. Just notice how it is right now. So some people have a pattern called reverse breathing, where the belly kind of sucks in on the in-breath. Again, there can be many reasons for that. So if that's your pattern, just notice it. And feel free to contact me after class. There's some things I can give you to work on that. So it's very helpful to find our natural breath again, where the belly expands on inhaling and draws back on exhaling. Because it basically then utilizes the diaphragm in a way that's more helpful to maximize the benefit of breathing. And then we're going to see if it's comfortable to interlace our fingers and bring our hands behind our head. If you're sitting, it might even be comfortable to put them on your head, interlacing and putting them on your head, so your shoulders can relax. If you've got any neck problems, that might not be super comfortable, so behind might feel better. And if you're lying down, you can also just bring your arms wider, elbows bent, something like this, or out there. Also, if you're sitting and you can't raise your shoulders in that way, you can do something like this, hands on shoulders and maybe elbows up a little bit, or going back to this position, hands on the collarbones and elbows by your side. But we're basically trying to create a little bit of a stretch and space at the side ribs and armpits. So seeing how that works for you. And then again, breathing out fully a few times and breathing in a natural way. So when we've done that sort of fuller exhalation, then the in-breath can often feel easier, deeper, and gently energizing. And then we can bring our arms back down. Lovely. And then we'll pay a bit of attention to the back of the body. So if you're sitting on a chair or maybe similar to me, you can come forwards, little forward bend, maybe hands on the floor, on your knees, or sliding down your legs. And you can take a few deep breaths that way. A gentle seated forward bend. If you're lying on your back, you can bring your knees in towards your chest. So we do this quite often in classes. I will give a little demonstration as well, in case it's needed. Bring your knees in towards you and then taking a rock from side to side. And being aware of your breathing, feeling your back. And when you're ready to, if you're lying down, you might like a couple of breaths on your side. And first, coming up to sitting. So from standing, first we can establish our feet on the ground. Just get my screen at the right angle. So about hip width apart. And then standing straight through the back. So obviously our back won't be completely straight because the spine has curves, but sense of lengthening up through the crown as well as being very rooted through our heels. You can soften your knees a little bit, unlock your knees so you're not pushing them back, which tends to lock up the lower back a little bit as well. So you can even have a little wriggle with your knees bending, alternating bending, a little bit of a shake from side to side of your tailbone, and then once that you've got that feeling of your knees being unlocked, tailbone just hanging down as it were, and you can lengthen up through the crown at the same time. And a sense of softening the front of the body, so a little bit of movement felt in the belly perhaps as you breathe, and the chest. So those patterns are still there, but a little different when we're standing from when we're sitting or lying. You can feel that for a moment, feeling our breath. Releasing our arms again, noticing how our arms and shoulders just kind of hanging down like a coat hanger, coat hanging on a coat hanger, nice and relaxed. We'll do a simple side bend, and you can do this with your arms by your side. It'll be a little bit more opening for the side lungs if we take the arm up, but it might be, this position might be better for you. So you've got this option, or going a bit further up like that. So we're going to breathe in and take the arm up, and then breathing out and going over. Breathing in, coming back, breathing out, releasing the arms. Inhaling to the other side, exhaling, going over. Inhaling, starting the journey back, exhaling down. From side to side. So you might feel a bit more of a stretch along the side ribs. Demonstrating it in a couple of different ways. So you can see how it feels. You might like to try both. Does it feel more comfortable with your arm completely raised, or with your hand on your elbow, on your shoulder, I mean? And doing one more to each side. And then you come back to standing again, releasing your arms and shoulders to have that sense of them being like a coat hanging off a coat hanger. And we're going to bring our hands to the front with relaxed hands, so give them a little bit of a shake as well, make sure they're relaxed, and the elbows slightly raised, not far, just very slightly. And then I'll show you sideways one. We'll see if we can just draw our shoulder blades together and then relax. So it's a slight lifting of the chest, very slight, just activating the upper back muscles. And you can make it bigger by drawing your elbows back, but see if you can do it by organizing your shoulders rather than the whole of your arms. So it might be quite small. So you're drawing your shoulders back, your shoulder blades towards your spine, and then releasing. And if it's hard to find that movement, you can engage your arms a bit more, seeing if that helps. And then we can release our arms again. And then crossing our arms over our chest. So this is also the self-care gesture. And this will be opening up the upper back as well. So if we take a few complete out breaths here and then deeper in breaths, you might feel the breath much more in the area of the upper back, stimulating the back of the lungs to do some breathing work. And a couple of friends and students who have also had symptoms of COVID, I think they may have had it. Obviously, most of us have no idea whether it's actually that, but heard some reports of people having upper back pain. So this is a really gentle way to massage our own upper back. And then we can wrap our arms the other way and do a few more breaths like that. And then we can release our arms again and do a gentle kind of loosening twist. We can take one foot forward. I've taken my left foot forwards. You could mirror me and take your right foot forwards. And then we just start with bringing, if you're mirroring me, your right arm forwards and your left arm back. Again, quite gently. I'm not doing it sort of in a huge way, quite gentle. And then just letting them swing. So very little effort. My elbows are bending, my elbows are quite soft. And again, it's just relaxing, activating and relaxing all those muscles around the rib cage. And then if it's comfortable again, you could swing up a little bit higher. And then let one hand come up, let the other hand come up. Again, they could go behind your head. You can lift your chest for a moment. If that's not comfortable, you could have your arms down and behind you. And then release. And taking your other foot forwards. So if your left foot is forwards now, then your left arm ahead. And then letting your arms swing. You can be a bit more vigorous if you want to be. And then letting one hand swing up quite high and kind of see if it wants to go behind your head, joined by the other one, and back bend like this, or like this if your shoulders are not up for that. And then releasing again. And then we can do a standing forward bend, so you can make this quite small. So apparently if you have got congestion in your lungs, the forward bends are very helpful, because obviously gravity is going to be keeping the congestion down in your lungs a lot, so it can make it harder to cough it out. So it's quite useful to do forward bends. Obviously this one we don't tend to hold too long, especially if anyone's got high blood pressure. If it's not treated, you wouldn't want to take your head below your heart for too long, or if you've had strokes or anything like that. So you could do a gentle one just to release your head, neck and shoulders. Or you can go a bit further and stay for a few breaths. And I've seen some physio advice of kind of doing like a supported downward dog over a chair or an exercise ball. I'm just going to demonstrate that with a chair. You don't have to do this now, but I just wanted to share that with you. So you would hang yourself over a chair. Just need to change my angle here. With your hips on a chair, you could have some cushions and then slide forwards a little bit, kind of like a supported dog pose. So your lungs are going slightly down, to shuffle a bit, and it doesn't have to be a huge angle, but that would help the congestion to move to the top of your lungs, and you can expel it more easily. So that would be easier to maintain for the recommended sort of 5 minutes than being in downward dog or a forward bend. So you might like to bear that one in mind in case you get any congestion in your lungs. But for now we can do a simple forward bend. So going forwards, and again breathing out fully 3 or 4 times in that if you can, if it's safe for you to stay down there for a few breaths. That can be really, really helpful. And letting go of your head and neck and shoulders as you do this. And then coming back up when you're ready to. And we can take our feet a bit wider and finish this section with a gentle twist. So again, this is a nice one to reduce any kind of aches and pains in the upper body. And move the rib cage muscles around. And we can do a final shake out as well of the arms, the legs. A bit of a jiggle. And then take a moment in standing. And again, noticing how we are, noticing whether we can relax our shoulders, arms, maybe feeling a bit of energy flowing to our hands and to our feet, and different parts of the body. Noticing how our breathing is.